Welcome, colleagues and batch flower enthusiasts. Today, we begin our study of Star of Bethlehem, one of the most important remedies in the entire batch flower system. Dr. Edward Bach regarded this remedy as the great comforter for those who have experienced shock, grief, trauma, or emotional suffering. Unlike remedies that primarily address personality traits or emotional tendencies, Star of Bethlehem focuses on the effects of a disturbing event that has left a lasting impression on individual. The event may be recent or may have occurred many years ago, yet its impact continues to influence emotional well-being. Trauma can arise from bereavement, accidents, illness, surgery, emotional betrayal, childhood experiences, or any circumstance that overwhelms a person's ability to cope. Star of Bethlehem helps restore balance after such experiences and supports the natural healing process. Throughout this masterclass, we will explore how to recognize these states and apply this remedy effectively in clinical practice. Star of Bethlehem belongs to Group 6, the bachelor group associated with despondency and despair. However, its position within this group is unique. Many remedies in this group address emotional responses such as guilt, hopelessness, resentment, overwhelm, or lack of confidence. Star of Bethlehem addresses something deeper. It focuses on the shock that may lie behind many of these emotional conditions. Sometimes a patient presents with anxiety, depression, low confidence, chronic grief, or emotional numbness. As practitioners, we must ask whether there was a significant event that changed the person's life. Often the answer reveals an unresolved trauma that has never been fully processed. This remedy reminds us that emotional symptoms are sometimes consequences rather than the causes. By addressing the original shock, healing can occur at much deeper level, and other remedies often work more effectively. Trauma occurs when an experience overwhelms a person's normal ability to process and adapt. It's important to understand that trauma is highly individual. An event that one person recovers from quickly may leave another person deeply affected. Trauma may result from a sudden accident, the death of a loved one, abuse, rejection, frightening, medical procedures, financial collapse, or unexpected life changes. In some cases, the emotional effects appear immediately. In others, symptoms may emerge months or even years later. Patients often describe feeling different after the event, as though a part of them never fully recovered. They may become withdrawn, emotionally numb, anxious, or unusually sensitive. Star of Bethlehem helps individuals process these unresolved experiences and supports the restoration of emotional stability and resilience. Shock typically follows a sequence. First, a disturbing event occurs. Second, the emotional system becomes overwhelmed. Third, protective mechanisms develop to help the person survive emotionally. Finally, if the shock remains unresolved, long-term consequences begin to appear. These consequences may include fear, grief, emotional detachment, sleep disturbances, irritability, chronic sadness, or difficulty trusting others. Many patients are unaware that their current symptoms are linked to an event from the past. The body's protective responses are valuable during the crisis itself, but they are not meant to become permanent. When emotional healing is incomplete, These protective patterns may persist long after the danger has passed. Star of Bethlehem helps the individual move beyond survival mode and gradually return to a more balanced and integrated emotional state. One of the most important concepts in understanding Star of Bethlehem is the idea of the frozen moment. Following a severe shock, part of the emotional system may become stuck at the time the event occurred. Life continues externally, but internally the person may remain connected to the original experience. Certain memories, situations, or anniversaries can trigger powerful emotional reactions because the trauma has never been fully resolved. Some individuals become emotionally numb, others repeatedly relive the experience. Some avoid discussing it altogether. In children, the effects may show up through behavioral changes rather than verbal expression. Star of Bethlehem gently assists the emotional system in completing a healing process that was interrupted by shock. It helps release the frozen aspect of the experience so that the person can move forward without carrying the same emotional burden. The healing process supported by Star of Bethlehem is not about forgetting the past. Instead, it's about integrating the experience in a healthy way. As healing occurs, patients often report feeling lighter, calmer, and more emotionally stable. Painful memories may still persist or exist, but they no longer dominate daily life. The emotional change, the emotional charge associated with the event gradually decreases. Some individuals experience emotional release through tears, conversation, reflection, or increased self awareness. Others simply notice a growing sense of peace and acceptance. The ultimate goal of Star of Bethlehem is restoration. It helps reconnect fragmented emotional experiences, allowing the individual to regain confidence, resilience, and inner harmony. In this way, it serves as one of the most valuable remedies for supporting recovery after life's most difficult experiences. To understand any Bach Flower remedy deeply, we should begin with Dr. Edward Bach's own observations. Bach did not view illness simply as a physical problem. He believed that emotional disharmony often preceded physical symptoms and that healing required addressing the underlying emotional state. Among all the remedies he discovered, Star of Bethlehem occupied a special place because of its ability to comfort suffering caused by shock and distress. Bach repeatedly observed that many patients carried emotional wounds from past experiences that continued to affect their health and well being. Whether the shock resulted from bereavement, injury, disappointment, or frightening experiences, the emotional imprint often remained long after the event itself. Star of Bethlehem was developed to help individuals recover from these disturbances and regain emotional equilibrium. It remains one of the most frequently used batch remedies because almost everyone experiences some form of emotional shock during life. Because of its action on shock and grief, Star of Bethlehem is often called the comforter of sorrows. This title reflects its unique role within the batch system. When people experience profound loss, they often feel emotionally stunned. Some cry continuously, while others become completely numb. Some withdraw from social contact, while others appear outwardly normal despite intense inner suffering. The remedy does not force emotional expression, nor does it suppress emotions. Instead, it provides gentle support while the individual processes their pain. This makes Star of Bethlehem valuable not only immediately after a loss, but also months or years later when unresolved grief continues to affect emotional health. It helps transform sorrow from a frozen wound into an experience that can be acknowledged, understood, and eventually integrated into the person's life journey. Although grief is a common indication, Star of Bethlehem should never be considered only a bereavement remedy. Many forms of trauma can create the same emotional pattern. A frightening accident, a difficult childbirth, a sudden diagnosis, surgery, emotional abuse, betrayal, public humiliation, or a major financial loss can all leave lasting emotional scars. Sometimes the patient does not describe sadness at all. Instead, they report anxiety, insomnia, emotional numbness, irritability, lack of confidence, or difficulty moving forward in life. This is why careful case taking is essential. When we look beneath the presenting symptoms, we may discover an unresolved event that continues to influence the patient's emotional state. In such situations, Star of Bethlehem often becomes one of the most important remedies in the prescription, helping address the original disturbance rather than merely managing its consequences. Dr. Bach regarded Star of Bethlehem as one of the most universally useful remedies because shock is a nearly universal human experience. Few people pass through life without encountering bereavement, disappointment, injury, illness, or emotional trauma. While many recover naturally, others carry the effects for years without realizing it. In clinical practice, unresolved shock frequently acts as a hidden obstacle to healing. Patients may receive appropriate remedies for anxiety, grief, hopelessness, or lack of confidence. Yet progress remains incomplete because the original trauma has not been addressed. Star of Bethlehem often helps remove this obstacle. By supporting emotional recovery from past shocks, it creates a stronger foundation for overall healing. For this reason, many practitioners consider it not only a remedy for trauma, but also a remedy that helps unlock deeper healing across a wide range of emotional and physical conditions. One of the fascinating aspects of Bach flower study is observing how the physical characteristics of a plant often reflects its emotional healing qualities. Star of Bethlehem, botanically known as Ornithogallum umbellatum, is a delicate white flowering plant belonging to the lily family. At first glance, the plant appears simple and gentle. Yet beneath the soil lies a resilient bulb capable of surviving difficult conditions and producing beautiful flowers year after year. This mirrors the human experience after trauma. Even when a person appears emotionally damaged or depleted, a core of vitality often remains intact beneath the surface. The remedy reminds us that healing is not about creating strength where none exists. Rather, it's about reconnecting the individual with the strength that has always been present. The botanical characteristics of this plant peacefully, beautifully illustrate the themes of comfort, recovery, resilience, and renewal that define the Star of Bethlehem state. Perhaps the most striking feature of this plant is its star-shaped white flower. Historically, the star has been associated with guidance, hope, illumination, and direction during times of darkness. When individuals experience trauma, they often feel lost or disconnected from their usual sense of stability. Life may suddenly seem uncertain, confusing, or emotionally overwhelming. In such moments, the symbolic image of a star becomes especially meaningful. The pure white color suggests peace, comfort, healing, and restoration. It represents the calming influence that follows emotional turbulence. From a symbolic perspective, the flower appears like a light shining through darkness, offering reassurance that recovery is possible. This reflects the clinical action of Star of Bethlehem. The remedy does not erase suffering, but it helps guide the individual through it, allowing them to gradually rediscover balance, hope, and emotional well being. Another interesting feature of Star of Bethlehem is the way its flowers naturally open toward the light. This upward orientation provides a meaningful symbolic lesson. Trauma often pulls people inward and downward. Individuals may become withdrawn, discouraged, emotionally numb, or disconnected from life around them. Their attention becomes focused on pain, loss, or fear. The flower's upward movement suggests the process of recovery. It represents the gradual return of emotional openness, perspective, and hope. Rather than remaining trapped in the memory of the traumatic event, the individual slowly begins looking forward again. Clinically, we often observe this shift after successful prescribing. Patients may report renewed interest in daily activities, improved emotional resilience, and a greater willingness to engage with life. The plant's natural orientation serves as a beautiful reminder that healing involves not only releasing pain but also restoring one's capacity to move forward. Hidden beneath the ground lies the bulb from which the plant grows. The bulb functions as a storehouse of energy, allowing the plant to survive adverse conditions and regenerate when circumstances become favorable. This characteristic has a powerful symbolic connection to trauma recovery. During periods of shock or emotional distress, individuals often feel as though they have lost their strength. However, much like the bulb beneath the soil, their inner resources may simply be hidden rather than destroyed. The Star of Bethlehem state often involves reconnecting with these dormant reserves of resilience. The remedy helps individuals access emotional resources that were temporarily buried beneath grief, fear, or shock. The bulb reminds us that recovery does not always happen immediately. Healing may require time, patience, and the right conditions. Yet the potential for renewal remains present even during the darkest periods of life. Star of Bethlehem emerges and flowers after a period of dormancy. This seasonal pattern reflects one of the most important principles of healing. Recovery often occurs in stages. Following trauma, individuals may pass through periods of emotional withdrawal, numbness, confusion, or inactivity. To observers, it may appear as though no progress is being made. However, important healing processes are often occurring beneath the surface. Just as the plant prepares for growth long before its flowers become visible, Emotional recovery may begin before obvious changes appear. This understanding is especially important for practitioners. Patients recovering from trauma should not be pressured into rapid improvement. Healing unfolds according to its own timeline. The life cycle of the plant teaches patience and trust. Even after a period of emotional winter, new growth, hope, and vitality can eventually emerge. The doctrine of signature suggests that the appearance and behavior of a plant may offer clues regarding its therapeutic application. While not a scientific principle, it provides an interesting way of understanding remedy symbolism. In the case of Star of Bethlehem, several features align remarkably well with its clinical use. The white star-shaped flower suggests comfort, guidance, and healing after darkness. The hidden bulb represents preserved inner strength. The plant's ability to re-emerge after dormancy reflects recovery following trauma. Together, these characteristics creates a coherent picture of restoration after emotional injury. Whether one views these correspondences symbolically or simply as useful teaching tools, they help reinforce the central theme of the remedy, helping individuals recover from experiences that have disrupted their emotional equilibrium and reconnect with their natural capacity for healing. The botanical characteristics of Star of Bethlehem provide several valuable clinical insights. The white flower reminds us of the remedy's comforting and soothing action. The upward facing blossom symbolizes hope and recovery. The underground bulb represents hidden resilience, while the plant's seasonal growth reflects the gradual nature of healing. When viewed together, these features create a powerful picture of transformation following adversity. For practitioners, the key lesson is that trauma does not permanently destroy a person's capacity for well being. Beneath the emotional pain, a healthy and resilient core often remains intact. Star of Bethlehem helps patients reconnect with that inner strength, allowing healing to unfold naturally. As we move into the next section, we will leave the botanical world behind and examine the many ways trauma presents clinically throughout different stages of life. Star of Bethlehem is perhaps best known for its role in acute shock. These are situations where a person experiences a sudden event that overwhelms their emotional balance. Examples include accidents, unexpected bereavement, frightening diagnosis, surgery, natural disasters, or receiving devastating news. Immediately after such events, people may cry uncontrollably, become emotionally numb, feel dazed, or appear detached from reality. Some cannot speak about what happened, while others repeatedly relive that event. In these situations, Star of Bethlehem provides emotional support and comfort. It helps the individual begin processing the shock rather than remaining frozen in it. This is why it is also one of the key ingredients in rescue remedy and is frequently used during emotional emergencies. Not all trauma reveals itself immediately. Some individuals appear to cope remarkably well after a difficult event, only to develop emotional symptoms months or years later. A patient may tell you, I was fine at the time, but after that, nothing felt the same. They may experience anxiety, emotional numbness, low motivation, poor sleep, or unexplained sadness without recognizing the connection to the original event. This delayed presentation is common after the childhood trauma, bereavement, divorce, accidents, or emotionally overwhelming experiences. As practitioners, it's important to explore significant life events during case taking. Often, the hidden key to the case lies in an unresolved shock that was never fully processed. Star of Bethlehem helps address these lingering effects and allows deeper emotional healing to take place. One of the classic indications for Star of Bethlehem is grief following the loss of a loved one. While grief is a natural human response, some individuals become emotionally stuck in the mourning process. They may feel unable to accept the loss, emotionally numb, withdrawn, or overwhelmed by sadness. Others continue functioning outwardly while carrying profound unresolved grief internally. Star of Bethlehem does not remove the natural process of mourning. Instead, it provides comfort and support during that journey. It helps soften emotional shock, making it easier for the individual to process the loss in a healthy manner. The remedy is particularly useful when grief has remained unresolved for months or years and continues to affect emotional well being, relationships, or overall quality of life. Emotional trauma is not limited to physical events or bereavement. Deep emotional wounds can result from betrayal, divorce, abandonment, rejection, or the sudden breakdown of important relationships. Patients often describe feeling shocked by the experience. Their trust may be shattered, leaving them fearful of future relationships or emotionally guarded. Some develop anxiety, sadness, insecurity, or difficulty connecting with others. In these cases, Star of Bethlehem addresses the emotional injury created by the event. It helps the person process the shock and gradually regain emotional stability. The remedy is especially valuable when a patient repeatedly returns to the same painful memory and feels unable to move beyond the experience despite the passage of time. Many adult emotional difficulties have roots in childhood experiences. Emotional neglect, parental conflict, bullying, frightening events, loss of a parent, abuse, or repeated criticism can leave lasting impressions on a developing child. Children often lack the emotional maturity to process these experiences fully. As a result, the effects may remain hidden until adulthood. Patients may not immediately identify these events as traumatic because they have become normalized over time. Yet, careful case taking frequently reveals experiences that contributed significantly to emotional development. Star of Bethlehem can be valuable in helping adults process unresolved childhood wounds. By addressing the original emotional injury, the remedy often supports improvements in self esteem, relationships, confidence, and overall emotional resilience. Birth is one of the most significant transitions in life, and in some cases, it may involve considerable stress for both mother and the child. Difficult labor, emergency interventions, prolonged delivery, separation after birth, or frightening complications can create emotional shock. While not always recognized, these experiences may leave lasting emotional impressions. Star of Bethlehem has traditionally been used to support recovery after difficult childbirth. It may be considered for mothers who feel emotionally shaken following the delivery and for infants who have experienced stressful birth circumstances. Although the concept of birth trauma is complex, many Bach Flower practitioners regard Star of Bethlehem as an important remedy whenever significant emotional or physical shock accompanies the birth process. Physical injuries often affect more than the body. Accidents, fractures, burns, surgeries, and medical procedures can create significant emotional shock in addition to physical damage. Even after physical healing has occurred, the emotional impact may persist. Some patients remain fearful, anxious, or unusually sensitive following the event. Others become emotionally detached or avoid situations associated with the trauma. Star of Bethlehem helps address the emotional component of physical injury. It provides comfort during recovery and supports emotional adaptation after distressing medical experiences. This broader perspective reminds us that healing involves both physical and emotional dimensions. Addressing only one aspect may leave important elements of recovery incomplete. Not all wounds are visible. Emotional trauma can result from humiliation, rejection, betrayal, criticism, neglect, or experiences that deeply affect a person's sense of security and self worth. These events may leave no physical evidence, yet their emotional impact can be profound. Patients often carry feelings of hurt, vulnerability, sadness, or emotional numbness for years. Because emotional trauma is sometimes minimized by others, individuals may feel isolated in their suffering. They may even question whether their reaction is justified. Star of Bethlehem acknowledges the reality of emotional wounds. It helps the individual process the experience without judgment and supports the gradual restoration of emotional well being. This makes it one of the most compassionate remedies in the Bach Flower system. Sometimes trauma affects not just individuals but entire families, communities, or societies. Natural disasters, violence, war, epidemics, accidents, and other collective crises can create widespread emotional distress. People exposed to such events may experience grief, fear, uncertainty, and emotional shock. Even those not directly involved can be affected through loss, disruption, or witnessing suffering. In these situations, Star of Bethlehem may provide valuable emotional support. Its role is not limited to personal trauma. It can also assist individuals processing collective experiences that have left a lasting emotional impact. This broader application highlights the remedy's universal relevance. Wherever emotional shock exists, Star of Bethlehem may have a role to play. As we conclude this section, it's helpful to view trauma as a spectrum rather than a single condition. At one end are acute events such as accidents, bereavements, or frightening experiences. At the other end are subtle, long-standing emotional wounds that may have developed over many years. Some patients clearly identify the traumatic event. Others require careful exploration before the connection becomes apparent. The key lesson for practitioners is to look beyond the presenting symptoms. Anxiety, grief, low confidence, emotional numbness, or chronic distress may all have roots in unresolved shock. Star of Bethlehem helps address this underlying disturbance. By supporting emotional integration and recovery, it often becomes a foundation upon which deeper healing can occur. Now let's pivot from the abstract concept of trauma and look at the hard biology. When we experience an emotional or physical shock, it doesn't just vanish into the ether of our memories. It takes up a physical residence in our neuron system, nervous system, that is. In this slide, we are looking at the neurology of trauma, specifically how energetic shock manifests as a biological footprint and why our bodies sometimes get stuck in survival mode long after the danger has passed. When a sudden shock or trauma occurs, it acts like an electrical power surge in a house. If the system is overwhelmed, the circuit breakers trip. In the human body, an energetic shock bypasses normal cognitive processing and hits our autonomic nervous system directly. The body physically braces itself during the event. If that energy is never fully processed or discharged, the nervous system remains in a state of suspended animation, permanently preparing for a blow that has already landed. Let's define hypervigilance. This is not just being alert. This is a chronic, exhausting, involuntary state where the amygdala is constantly scanning the horizon for physical, emotional, and environmental threats. Patients in this state are easily startled by loud noises, have highly reactive nervous systems, and are preparing perpetually, waiting for the other shoe to drop. Their brains are locked in a loop, treating a peaceful present moment with the emergency protocols of a traumatic past. Living in a state of constant threat means the body is perpetually dumping cortisol and adrenaline into the bloodstream. This is adrenaline burn. The sympathetic nervous system is stuck on high overdrive. But the human body was never designed to run on emergency fuel indefinitely. Eventually, this constant sympathetic dominance burns out the system, resulting in profound unexplained fatigue, brain fog, and physical collapse. Your patient isn't just lazy or tired, their battery simply cannot hold a charge because the generator is constantly running in the background. This is where Star of Bethlehem comes into play as a tool for somatic grounding. How does it work? Think of it as a gentle grounding energetic frequency that targets those overactive fight or flight pathways. It doesn't dull the senses like a sedative. Instead, it signals to the deep primal brain that the crisis is over and it is safe to calm down. By soothing the sympathetic nervous system, it allows the parasympathetic nervous system to finally come back online. This grounding effect helps discharge the trapped kinetic energy of the shock, allowing the patient to finally drop their shoulders, breathe deeply, and anchor back into their physical body. Moving from general nervous system strain, let's look at one of the most common places trauma hides, our sleep patterns. When a person carries unresolved shock, unlocking deep physiological rest becomes nearly impossible. First, we see hyperarousal. This is a state where a patient physically cannot sleep because their system doesn't feel safe enough to disengage conscious control. Falling asleep requires letting your guard down, but a traumatized nervous system refuses to drop its defenses. Even if they do manage to drift off, they are often blocked by shock dreams. These are vivid nightmares that repeatedly replay the traumatic loop, causing the person to wake up completely unrefreshed with their heart racing. This is where Star of Bethlehem provides deep somatic relief. It works by quieting that hyperactive midnight startle response. By gently soothing the nervous system's alarm bells, it allows the body to finally drop into a state of genuine, deeper physiological rest so actual healing can begin. Now let's explore how unresolved trauma manifests as physical constriction, specifically looking at chronic headaches and muscle tension. When the mind cannot process a shock, the physical body attempts to contain it by bracing itself against the emotional pain. Following an emotional shock, the body creates a literal physical barrier, often referred to as somatic armor. The muscles of the neck, shoulders, and jaw contract tightly as an involuntary defense mechanism. This chronic contraction acts as a rigid defensive shield designed to seal away and contain the pain of historical trauma, which frequently results in tension headaches and localized pain. Star of Bethlehem works by targeting the core emotional stress trapped at the center of this physical bracing. As the remedy gently diffuses and releases the underlying emotional trauma, the corresponding muscular guarding patterns lose their purpose. The physical body finally feels safe enough to yield, soften, and dissolve the chronic physical stagnation. Let's shift our focus to another major axis of somatic trauma, the gut. The digestive tract is directly wired to our nervous system, meaning emotional shocks quickly translate into physical gastrointestinal distress. Traumatic experiences directly disrupt normal digestive vagal tone, throwing the enteric nervous system out of balance. This disruption leads to somatic stagnation, which clinically triggers acute symptoms such as nausea, painful spasms, acidity, or a persistent loss of appetite. Star of Bethlehem addresses this physical lockdown by helping to restore a healthy, balanced vagal tone to the system. By easing the chronic physiological shock held in the gut, it provides a somatic release, essentially allowing the digestive system to finally digest and clear historical traumatic incidences. The cardiovascular system is often the first to bear the brunt of sudden trauma, reflecting emotional wounds directly through physical pressure and rhythm changes. When sudden emotional pain hits, the body reacts as if it's under physical attack. This triggers immediate cardiovascular shock, causing sudden chest tightness, erratic or wild palpitations, and a genuinely terrifying sensation of physical constriction around the heart area. The patient feels as though they are physically suffocating or crushing under the weight of the shock. Star of Bethlehem is highly effective here because it deeply stabilizes anxiety-induced cardiac symptoms and eases the emotional paralysis triggering the physical reaction. However, a critical medical precaution must be stated. While we treat the energetic and emotional roots of these symptoms, all organic pathologies must be medically investigated and cleared by a physician to ensure patient safety first. Trauma is not a one size fits all experience. The way our nervous system registers, processes, and stores a shock depends heavily on a person's developmental stage. In this slide, we are going to explore how trauma uniquely manifests across three major life stages: childhood, adolescence, and the elderly years, and how Star of Bethlehem serves as a crucial supportive tool through each phase. First one is children. When a young child experiences a major scare, whether it's a sudden accident, a dog attack, a loud domestic argument, or the loss of a pet, they lack the adult cognitive tools to rationalize what happened. Because they cannot talk through it, their nervous system forces them to act it out. This looks like sudden developmental regression. A child who was fully potty trained might suddenly start wetting the bed again. They may display intense, uncharacteristic temper tantrums, severe separation anxiety, or an absolute refusal to leave a parent's side. Star of Bethlehem acts as a confronting, comforting presence. It works on a subverbal level to soothe the shock, helping the child's nervous system feel safe again so they can naturally drop the defensive regression and return to their normal developmental baseline. Second stage is adolescence. Teenagers are already navigating a hormonal cocktail and identity shifts. When you layer an emotional shock on top of that, such as a messy parental divorce, sudden social rejection, or school failure, their emotional baseline destabilizes rapidly. Adolescents typically react in one of two ways. They either explode into chaotic emotional storms or they implode, building massive walls of withdrawal and numbness. They hide their deep vulnerability under a mask of apathy or anger. Star of Bethlehem helps stabilize these intense fluctuations. It cuts through the emotional paralysis and provides a safe pathway for them to process their vulnerability without feeling exposed or overwhelmed, preventing the shock from turning into a long-term behavioral pattern. Third stage is of elderlies. As people enter their twilight years, the distractions of midlife drop away and the mind naturally turns towards reflection. Often, this reflection brings up ancient unresolved history. In elderly patients, we frequently see the sudden resurfacing of long held historical losses, unexpressed grief from decades prior, or deep, painful regrets about the past. Because these wounds have been buried for so long, they can cause the individual to feel frozen, rigid, or deeply melancholic. Star of Bethlehem serves as a gentle key to this vault. It acts as the ultimate comforter of the soul, helping to soften and release these decades old energetic blockades. It allows elderly individuals to finally integrate their oldest sorrows, bringing a sense of closure, comfort, and peace to their later years. Now, how to recognize this hidden trauma? Look for a clear structural anchor in the patient's history. When you map out their clinical timeline, you will often find that a cluster of seemingly distinct, complex physical or emotional symptoms all trace back to a clear, specific historic date, the exact moment the shock occurred. This is the classic emotional presentation of a deeply blocked patient. Frozen grief. When discussing severe past losses or trauma, the patient exhibits a completely closed archetype. They speak about deeply painful events with zero external affect, flat vocal tones, and absolutely no tears. The grief isn't gone, it's completely frozen and encapsulated within them. The diagnostic key is the essential question we should ask. When you hit a wall with a complex case, use this specific phrase. The question. Directly ask the patient, what happened shortly before your health changed? This single inquiry bridges the gap between their current physical suffering and the historical trauma that triggered it. Now let's look at our first case study, which involves a 52-year-old client who unexpectedly lost her spouse. Instead of showing outward grief, she presented in a state of total emotional numbness. She was completely unable to weep and suffered from severe insomnia, which is a classic defensive lockdown against overwhelming pain. Within just 2 days of introducing Star of Bethlehem, her protective energetic block melted. This allowed her to finally release healthy, flowing tears and brought immediate deep physical rest to her exhausted nervous system. Second case highlights the lingering trauma of an accident. The client was involved in a severe highway crash. While his physical recovery was completely successful, his emotional body remained trapped in the event. He faced debilitating panic attacks and recurring nightmares whenever he tried to drive. Consistent use of Star of Bethlehem targeted this residual somatic fright. It dissolved the frozen memory loop, giving him back his confidence and ease behind the wheel. In case 3, we look at developmental trauma resurfacing in adulthood. This client suffered from chronic toxic insecurity and severe public performance anxiety. When we mapped his history, we found these traits were deeply rooted in harsh, continuous parental criticism during childhood. Daily use of Star of Bethlehem acted as an emotional comforter for these early wounds. It worked to repair those foundational trust issues and slowly rebuild the stable sense of structural self worth from the ground up. Case 4 addresses a frequently overlooked form of trauma, clinical intervention. Following major abdominal surgery, this client felt emotionally fragmented, deeply vulnerable, and consumed by fear of illness. Anesthesia and invasive procedures can traumatize the energetic body, even if the patient is unconscious. Star of Bethlehem was introduced to clear the hidden shock of medical intervention. It stabilized her energetic flow, helping her feel whole again and speeding up her physical vitality. Our final case involves a client facing a massive relational rupture. Upon discovering relationship infidelity, she experienced acute emotional shock, sudden panic loops, and an obsessive recurring playback of the hurtful memories. Star of Bethlehem was used here to stabilize the heart center. It quieted the emergency panic loops and settled her nervous system, which cleared the mental space she needed to deeply process the grief and establish firm boundaries moving forward. To conclude these cases, let's look at the clinical integration. First, recognize the universal thread. Whether the trigger is physical surgery, sudden emotional loss, or a relationship betrayal, the core issue is identical: a frozen emotional signature that locks the nervous system in place. Second, remember the mechanism of somatic integration. Stubborn physical and behavioral symptoms resolve naturally once that underlying energetic shock is dissolved, proving the profound, undeniable link between the mind and the body. These two remedies are often prescribed together, yet they address very different states. Star of Bethlehem focuses on the effects of a traumatic event. The person has been emotionally wounded by shock, loss, fright, betrayal, or distressing experiences. Sweet chestnut, on the other hand, represents the point of ultimate mental suffering. The patient feels pushed to the absolute limit of endurance. They may describe feeling completely broken, abandoned, or unable to continue. The useful question is, what came first? If severe suffering developed after a traumatic event and the shock remains unresolved, think of Star of Bethlehem. If the person has reached a state of unbearable anguish, regardless of a specific trauma, sweet chestnut becomes more prominent. In practice, these remedies are frequently complementary rather than mutually exclusive. Both remedies have a relationship with past experiences, but their focus differs significantly. The Star of Bethlehem patient suffers because a past event created emotional trauma. The event continues affecting the person because it has not been fully processed. The honeysuckle patient is attached to the past itself. They may constantly reminiscence, compare their present unfavorably with earlier times, or long for what has been lost. In Star of Bethlehem, the issue is emotional injury. In Honeysuckle, the issue is emotional attachment. A bereaved individual who remains emotionally shocked by the death may need Star of Bethlehem. A person who spends years longing for happier times with the deceased may need honeysuckle. The distinction is subtle but clinically important. Following trauma, patients may develop resentment and bitterness. This is where the distinction between Star of Bethlehem and Willow becomes important. The Star of Bethlehem patient primarily suffers from emotional shock and pain. They feel wounded by what happened. The Willow patient focuses on perceived injustice. They ask, why did this happen to me? They may blame circumstances, fate, family members, colleagues, or society for their suffering. The emotional tone becomes resentful, bitter, and sometimes self pitying. In simple terms, Star of Bethlehem says, I am hurt. Willow says, I have been treated unfairly. When bitterness becomes the dominant emotional feature, Willow deserves consideration. Gorse represents loss of hope. The patient has largely given up believing that improvement is possible. The Star of Bethlehem patient may feel distressed, shocked, or emotionally wounded, but hopelessness is not necessarily the central feature. A person can experience severe trauma and still remain hopeful for recovery. Conversely, a Gorse patient may feel hopeless even without a significant traumatic history. Clinically, trauma that remains unresolved for many years can eventually lead to hopelessness. In such cases, both remedies may be required. When selecting between them, ask yourself, what is the dominant issue? If it is emotional shock, think Star of Bethlehem. If it is loss of hope, think Gorse. Pine is the remedy for guilt, self-blame, and excessive self-reproach. The patient continually believes they have done something wrong. Even when circumstances were beyond their control, they assume responsibility. Star of Bethlehem differs because the focus is on emotional injury rather than guilt. For example, after a tragic event, one patient may feel traumatized by what occurred. Another may spend years blaming themselves for not preventing it. The first picture points towards Star of Bethlehem, the second points towards Pine. Of course, trauma and guilt frequently coexist. This is especially common after accidents, bereavement, parenting decisions, or medical situations. In such cases, combining both remedies may be appropriate. Many people first encounter Star of Bethlehem through Rescue Remedy. Rescue Remedy contains 5 Bach flowers: Star of Bethlehem, Rock Rose, Impatience, Cherry Plum, and Clematis. Within this combination, Star of Bethlehem serves as the principal remedy for shock and trauma. However, Rescue Remedy is intended primarily for acute situations and emotional emergencies. Star of Bethlehem alone may be more appropriate when trauma remains unresolved for months or years. A useful way to remember this is Rescue Remedy addresses the immediate crisis. Star of Bethlehem addresses the deeper imprint left by the crisis. Understanding this distinction greatly improves clinical prescribing. As we conclude this differential section, remember that batch prescribing depends on identifying the dominant emotional pattern. Star of Bethlehem is fundamentally a remedy for unresolved shock and trauma. Sweet chestnut represents unbearable suffering. Honeysuckle remains attached to the past. Willow resents the past. Gorse has lost hope. Pine blames itself. Rescue remedy addresses acute emotional emergencies. These distinctions help refine prescribing and prevent confusion between remedies that may initially appear similar. In many complex cases, more than one remedy may be indicated, but understanding the primary emotional theme allows us to select remedies with greater precision and confidence. For homeopathic practitioners, aconite is often the first remedy that comes to mind when discussing shock. However, its sphere is quite different from Star of Bethlehem. Aconite is characterized by acute fear, panic, terror, and a sense that something dreadful is about to happen. The patient may be restless, anxious, and convinced they are going to die. The reaction is immediate and intense. Star of Bethlehem focuses more on the emotional imprint left by the traumatic event. The panic may have subsided, but the shock remains unresolved. A simple way to remember this is Aconite addresses the storm itself. Star of Bethlehem addresses the aftermath of the storm. Following accidents, frightening diagnosis, or sudden crisis, these two remedies often complement each other beautifully. Arnica is one of the most famous remedies for injury and physical trauma. It is frequently prescribed after accidents, surgery, bruising, and physical shock. The Arnica patient often says, I am fine, even when clearly injured. There may be soreness, bruising, and a desire to be left alone. Star of Bethlehem, on the other hand, focuses on the emotional consequences of the experience. The body may have healed, but the emotional shock continues. In clinical practice, these remedies often work together. Arnica supports recovery from the physical impact of trauma, while Star of Bethlehem supports recovery from the emotional impact. Whenever a patient experiences a significant accident or surgical procedure, it's worth considering both dimensions of healing rather than focusing exclusively on the physical injury. Ignatia is one of the most important homeopathic remedies for grief, disappointment, and emotional upset. The Ignatia patient often displays contradictory emotions. They may laugh and cry alternately, sigh frequently, suppress emotions, or react unpredictably. Emotional sensitivity is a prominent feature. Star of Bethlehem differs because the central issue is trauma itself. The person has been emotionally wounded by an event that overwhelmed their capacity to cope. After bereavement, a patient who exhibits intense grief, reactions, sign, emotional contradictions, and sensitivity may point toward ignatia. A patient who appears emotionally stunned, frozen, numb, or unable to recover from the shock may point towards Star of Bethlehem. In grief cases, the two are frequently complementary rather than competitive. Natrum muriaticum is often associated with chronic grief, disappointment, and emotional reserve. These patients frequently keep their suffering private. They dislike consolation, dwell on past hurts, and may appear itself self-contained despite deep emotional pain. At first glance, this can resemble Star of Bethlehem, particularly when trauma occurred years earlier. The distinction lies in the focus. Star of Bethlehem addresses the unresolved shock itself. Natrum muriaticum addresses the person's long-term emotional adaptation to hurt and disappointment. In practice, a traumatic event may initially require a Star of Bethlehem, while the lingering emotional pattern that develops afterward may resemble Natrum muriaticum. Understanding this progression can be extremely helpful in both Bach flower and homeopathic prescribing. Opium occupies a unique place among remedies associated with shock. Following a frightening or traumatic experience, the individual may become emotionally and physically unresponsive. There can be numbness, insensitivity, lack of reaction, or a detached state that appears almost unreal. The person behaves as though the event never happened. Star of Bethlehem may also involve emotional numbness, but the emphasis remains on healing the emotional wound created by the trauma. Opium represents a deeper state of shutdown and non reactivity. The organism appears unable or unwilling to process the experience at all. Both remedies remind us that trauma does not always produce visible distress. Sometimes the absence of emotion can be just as significant as the presence of intense emotion. As homeopathic practitioners, we often encounter patients whose suffering involves both emotional trauma and characteristic homeopathic symptom patterns. Star of Bethlehem serves as a bridge between these worlds. It focuses specifically on unresolved shock and emotional injury. Aconite addresses acute terror, Arnica addresses physical trauma, Ignatia addresses active grief, Natrum muriaticum addresses long-held emotional pain, Opium addresses shock with profound numbness. Recognizing these distinctions allows us to integrate Bach flowers and homeopathy more effectively. Rather than viewing them as competing systems, we can use each where it offers the greatest benefit to the patient. This is one of the most useful Bach flower combinations in clinical practice. Star of Bethlehem plus sweet chestnut plus walnut. Star of Bethlehem addresses the emotional shock itself. Sweet chestnut helps when the person feels pushed beyond their limits and experiences profound mental suffering. Walnut supports adaptation and protection during periods of major life change. Consider this trio after bereavement, divorce, serious illnesses, surgery, accidents, retirement, relocation, or other significant transitions. The combination helps patients process trauma, navigate change, and gradually rebuild emotional stability. While each remedy has a distinct role, together they provide comprehensive support during periods of major emotional upheaval. Grief recovery trio, Star of Bethlehem plus honeysuckle plus gentian. Grief rarely involves a single emotional state. Patients may experience shock, longing for the past, and discouragement simultaneously. In this trio, Star of Bethlehem addresses the trauma of the loss. Honeysuckle helps individuals who remain emotionally attached to what has been lost and struggle to engage with the present. Gentian supports those who become discouraged during the healing process. This combination is particularly valuable when grief persists beyond the expected adjustment period and the individual feels emotionally stuck. The goal is not to erase memories or suppress mourning. Rather, It's to help the person honor the past while gradually re engaging with life and future possibilities. Now, post betrayal healing trio: Star of Bethlehem plus Holly plus Willow. Relationship wounds often involve multiple emotional layers. There may be shock, hurt, anger, jealousy, resentments, or a sense of injustice. Star of Bethlehem addresses the emotional injury caused by the betrayal. Holy helps when anger, suspicion, jealousy, or emotional hostility dominate the picture. Velo assists when bitterness and resentment prevent emotional recovery. This combination can be useful following infidelity, broken trust, family conflict, workplace betrayal, or other situations where emotional wounds are intertwined with anger and disappointment. As healing progresses, patients often become less focused on the offender and more focused on their own recovery and future well being. Star of Bethlehem may be used either as a single remedy or within a customized batch flower combination. The standard batch method involves taking 2 drops in water 4 times daily. When used in a treatment bottle with other remedies, the usual batch doses instructions can be followed. In acute situations such as accidents, distressing news, or sudden emotional shocks, remedies may be taken more frequently according to individual need. For long-standing trauma, regular use over several weeks is often appropriate with periodic review of emotional progress. As always, batch flowers are intended to support emotional well-being and are not a substitute for appropriate medical, psychological, or psychiatric care when such care is required. Every bachelor remedy teaches a deeper life lesson, and Star of Bethlehem is no exception. The lesson of this remedy is that suffering does not have to define us permanently. Trauma may wound us, but it does not have to determine the rest of our lives. Star of Bethlehem teaches acceptance without resignation. It encourages us to acknowledge painful experiences while remaining open to healing and growth. Many patients discover that recovery does not mean forgetting the past. Instead, it means reaching a place where the past no longer controls the present. The remedy reminds us that emotional wounds can heal just as physical wounds can heal, provided they are given understanding, patience, and appropriate support. As we conclude our study of Star of Bethlehem, remember that this remedy is fundamentally about healing the effects of shock and trauma. Whether the event occurred yesterday or decades ago, unresolved emotional wounds can continue influencing health, relationships, and quality of life. Careful case taking often reveals these sudden and hidden influences. Star of Bethlehem serves as a gentle yet powerful support for emotional recovery. It helps transform frozen experiences into integrated experiences and allows individuals to move forward with greater peace and resilience. From acute bereavement to childhood traumas, from surgery to betrayal, its range of application is remarkably broad. Thank you for joining this masterclass. If you found this presentation valuable, please like, share, and subscribe. In the next session, we will continue our exploration of the batch flower remedies and their practical clinical applications. Thank you.